Hi there, you're welcome to my YouTube channel. My name is Kofi Bohyeba. On today's episode of Did You Know, we'll be talking about Hepatitis B virus. Did you know chronic hepatitis B could cause liver cancer and even lead to death? This is dangerous. Sit tight, relax as I explain everything to you, from the causes to the prevention and even the vaccination. Let's get this video started. You're welcome back. Hepatitis B is an infection of the liver caused by the hepatitis B virus. The infection can be acute, which is short-term, or chronic, which is long-term. Hepatitis B can cause a chronic infection and put people at high risk of death from liver cirrhosis and liver cancer. It can spread through contact with infected body fluids like blood, saliva, vaginal fluids, and semen. It can also be passed from a mother to her baby. Hepatitis B can be prevented with a safe and effective vaccine. The vaccine is usually given soon after birth with boosters a few weeks later. It offers nearly 100% protection against the virus. Hepatitis B is a major global health problem. The burden of infection is highest in the WHO Western Pacific region and the WHO African region, where 116 million and 81 million people respectively are chronically infected. The transmission. In highly endemic areas, hepatitis B is most commonly spread from mother to child at birth, perinatal transmission, or through horizontal transmission, exposure to infected blood, especially from an infected child to an uninfected child during the 5 years of birth and the 5 years of their life. The development of chronic infection is common in infants infected from their mothers or before the age of 5 years. Hepatitis B is also spread by needle stick injury, tattooing, piercing, and exposure to infected blood and body fluids such as saliva and menstrual, vaginal, and seminal fluids. Transmission of the virus may also occur through the reuse of contaminated needles and syringes, or sharp objects either in healthcare settings, in the community, among persons who inject drugs. Sexual transmission is more prevalent in unvaccinated persons with multiple sexual partners. Hepatitis B infection acquired in adulthood leads to chronic hepatitis in less than 5% of cases, where infection in infancy and early childhood leads to chronic hepatitis in about 95% of cases. This is the basis of strengthening and prioritizing infant and childhood vaccination. Hepatitis B virus can survive outside the body for at least 7 days. During this time, the virus can still cause infection if it enters the body of a person who is not protected by the vaccine. The incubation period of the hepatitis B virus ranges from 30 to 180 days. The virus may be detected within 30 to 60 days after infection and can persist and develop into chronic hepatitis B, especially when transmitted in infancy or childhood. Now to the symptoms. Most people do not experience any symptoms when newly infected. Some people have acute illness with symptoms that last for several weeks. Symptoms such as yellowing of the skin and eyes, jaundice, dark urine, feeling very tired, nausea, vomiting, and pain in the abdomen could be detected within this week. Although most people will recover from acute illnesses, some people with chronic hepatitis B will develop progressive liver disease and complications like liver cirrhosis and hepatocellular carcinoma, which is literally liver cancer. These diseases can be fatal and can lead to death. Now, the diagnosis. It is not possible on clinical grounds to differentiate between hepatitis B from hepatitis caused by other viral agents. Hence, laboratory confirmation of the diagnosis is essential. Severe blood tests are available to diagnose and monitor people with hepatitis B. Some laboratory tests can also be used to distinguish acute and chronic infections, whilst others can assess and monitor the severity of your liver disease. Physical examination, ultrasound, fibroscan can also be performed to assess degree of liver fibrosis and scarring and monitor progression of the liver disease. World Health Organization recommends that all blood donations be tested for hepatitis B to ensure blood safety and avoid accidental transmission. WHO recommends that all adults have access to and be offered hepatitis B surface antigen testing with linkage to prevention and care and treatment services as needed. WHO also recommends blood donor screening, routine testing for hepatitis B to provide the opportunity to institute measures of prevention for people in prisons and other closed settings. Now to the treatment. There is no specific treatment for acute hepatitis B. Chronic hepatitis B can be treated with medicines. Care for acute hepatitis B should focus on making the person comfortable. They should eat a healthy diet and drink plenty of liquids to prevent dehydration from vomiting and diarrhea. Treatment can slow the advance of the liver cirrhosis, reduce the cases of liver cancer, and also improve long-term survival. Most people who start hepatitis B treatment must continue it for life. It is estimated that 12 to 25% of people with chronic hepatitis B infection will require treatment, depending on certain and eligibility criteria. The ongoing 2023 update of the WHO Hepatitis B treatment guidelines will expand treatment eligibility and increase the proportion of people on treatment. In low-income settings, most people with liver cancer present late in the course of the disease and die within months of diagnosis. In high-income countries, patients present to the hospital earlier in the course of the disease and have access to surgery and chemotherapy, which can prolong life for several months to a few years. Liver transplantation is sometimes used in people with liver cirrhosis or liver cancer in technologically advanced countries with varying success. Now, to the prevention, which is the most important level of this presentation. Hepatitis B is preventable with a vaccine. All babies should receive the hepatitis B vaccine as soon as possible after birth, within 24 hours. This is followed by 2 or 3 doses of hepatitis B vaccine, which is at least 4 weeks apart. Booster vaccines are usually required for people who have completed the 3-dose vaccination series. Now to the good news. The vaccine protects against hepatitis B for at least 20 years and probably for life. Hepatitis B can be passed from mother to child, as I said earlier. This can be prevented by taking antiviral medicines to prevent transmission in addition to the vaccine. To reduce the risk of getting or spreading hepatitis B, practice safe sex by using condoms and reducing the number of sexual partners. Avoid sharing needles or any equipment used for injecting drugs, piercing, and/or tattooing. Wash your hands thoroughly with soap and water after coming into contact with blood, body fluid, or contaminated surfaces. Get a hepatitis B vaccine if working in a healthcare setting, and trust me, if you follow these preventive measures, it's going to go a long way to protect you from the virus. Thank you for watching this video to the end, and do well to share this video to your family and friends if you find it informative. Till we meet again, take a very good care of yourself, and if you haven't subscribed to my channel, please do well to subscribe to the channel. Remember, you can also make a difference, and don't forget, Kofi loves you. Peace out.